Lots of information if you want to ask me about it.
All right.
So I'm going to hand out just some quick definitions. I don't know if all right, well, like I said, my name is Mike Burggraaf. I'm the president of the Iowa Physical Therapy Association, and we represent about 1,400 members in Iowa. Also representing the American Physical Therapy Association and about 90,000 members across the country. I would like to ask, first of all, that the arguments that were made in our brief to intervene, that those were originally intended to answer the first 7 questions that were brought up in the declaratory order. As we asked a new question in the declaratory order, we would like to make sure that our points are still used on the new question, if that makes sense.
That does make sense.
Okay. So today, what comes before us is that we have, like William said, we have one question to ask, and that is physical therapy, is dry needling within the scope of practice of physical therapists in Iowa? I would agree we have to use definitions. The hard part is I think what this board is capable of using is the definitions that are in Iowa code. And that's where maybe some of the other arguments didn't mesh. So if we look in Iowa code, under the definition of physical therapy, and on the sheet of paper I gave you, I kind of bolded and highlighted a few words, as I think these are the ones that probably most fit with what we're talking about today. So physical therapy uses the affected properties of physical agents, including mechanical devices, and we use these to alleviate a physical impairment. So if we break that down a little bit and we look at what is a physical agent, it is physical, having material existence, it's perceptible, especially through senses, subject to the laws of nature. An agent is a means or an instrument. Mechanical device, of or relating to machinery or tools. Device, a piece of equipment. If we look at just those definitions, to think that a needle is not inclusive of being a physical device, or physical agent or mechanical device, I think we have to make a stretch to not think that includes in that definition. Also, if we look then, using the words that we use these things to alleviate a physical impairment, if you look at what the American Physical Therapy Association says dry needling does, is that physical therapists use this to manage neuromuscular pain, movement impairments. So again, we're using this to deal with an impairment. Looking at these kind of simple definitions, there was a kind of a decision by the board in September of 2010 that said, basically there was a question at that board meeting raised if PTs could perform dry needling under the scope of practice in Iowa, and the response that there was a consensus of the board in 2010 that dry needling does not appear to be prohibited by the use of physical therapists. So we would ask that basically the same decision that the board made at that time. Doesn't seem that anything has really changed, no code changes that would make a legitimate concern for change. I think, as we heard Mr. Terrell speak, I think that where we get confusion is definition of dry needling, definition of acupuncture. And again, unfortunately, for their argument, we have to use Iowa code to make that argument. And so if we look at what is acupuncture based on the Iowa code, which is what this board has the ability to determine, it's a form of healthcare developed from traditional and modern Oriental medical concepts that employs Oriental medical diagnosis and treatment. So, as a physical therapist, I can honestly say I don't know what that means. I don't do that. I don't deal with that on a daily basis. So, as one who doesn't personally do dry needling, however, if someone in my clinic were to use a needle, it would be using a physical therapy evaluation and assessment to determine if the use of a needle is appropriate for that patient or not. The second we throw in that it has to be an Oriental medical concept, it no longer applies to what a physical therapist does. So then we heard about the differences in scopes of practice, and I guess this is different professions use the same tools in different ways. And so I brought along a little example. This is a tool I got from a physical therapist in Ames. The physical therapist does wound debridement, and so it's an invasive technique in which they're cutting away dead skin. I also went to a friend who's a physician in the Des Moines area, and it's a very similar tool. They're a surgeon, so they use the same tool to cut the skin to get in and fix stuff, right? So if we just look at the tools in and of themselves, are physical therapists now saying we're surgeons because we use the same tool? Of course we're not. Physical therapists use the exact same tool for a much different outcome. And that's the difference. That's what we're talking about today. And as we were at the meeting in September, heard all the comments at that time, read through all of the public comments from the acupuncturists and PTs, and I'll be honest, I was really intrigued reading through it. It's very interesting. Three areas of concern that came up over and over again, and so I'd kind of like to talk about each of those. The concerns about physical therapists doing dry needling was number one, safety. Number two, concern of a lack of training. And thirdly, this kind of idea of there were concern of the effectiveness of someone other than an acupuncturist doing acupuncture. And so, again, we heard over and over concerns, but actually never saw any hard data that there was any issues with safety. Data, how can we see if there's been a safety issue? Number one, if there have been licensure board complaints that physical therapists were having problems. In our research, we've been unable to find any complaints to our licensure board about a physical therapist doing this. Secondly, there have been no malpractice issues. I've talked to my personal malpractice provider. We did research with the American Physical Therapy Association's preferred provider for malpractice insurance. And I think the very interesting thing is when you talk to these insurance providers who they make their living determining risk, right? I mean, that's how they make their living. Premiums for physical therapists who do dry needling are the exact same for as those for the physical therapists who do not do dry needling. So obviously insurance companies who, they're independent, they have no say, they have no say in this argument, right? But they don't charge anybody differently because there have been no safety issues. The lack of training, as mentioned before, and it is in our public comments as well, is the Federation of State Boards of Physical Therapy and their study. Honestly, good timing for this argument for us in the state of Iowa. What they did is they came out and they looked at two things. Number one, what do physical therapists need to know in order to safely perform dry needling? And secondly, what do they need to be able to do to be safe with dry needling? 86% of the things that physical therapists need to know, it was determined by this study, are accomplished in their entry-level education. Of the things that physical therapists need to do, the only thing that's not covered in the entry-level education is the psychomotor skills having to do with needles. So the idea, and on the forms that were handed out to the patients, the acupuncture patients that flooded your inboxes, it was obvious, it's a misnomer to say that physical therapists have 25 hours of training compared to the thousands and thousands of hours of training of someone else. It takes no account into the thousands and thousands of hours a physical therapist spends learning things that go along with treating a patient. The other thing I think on the lack of training issue I have an issue with is lack of training. It's the outcome of the training that means something. So if we were having significant safety issues with dry needling, I could see where the lack of training would be a concern. In this issue we come back to, there have been no issues with physical therapists in Iowa performing dry needling, so therefore it seems to me whatever our physical therapists are doing to train themselves seems to be appropriate at this time. The last argument is this, the idea of effectiveness, and I'll just come back to our definitions. First of all, the premise of this argument is wrong. Physical therapists aren't doing acupuncture. They're not doing an oriental medicine concept when they use a needle. They're using a physical therapy assessment, so that concern is wrong. The second part of this argument is kind of, what I draw from this is a marketplace argument. What we're doing is our board here is meant to provide safety for our public. Individual members of the public can determine what they think their best course of care is. So if a patient wants to go to physical therapy and have dry needling be a part of their plan of care of physical therapy, it seems to me they should have that option. If they want to go to their acupuncturist and have an acupuncture treatment, that is well within their rights too. I think one public comment that I read that I want to quote, it said, "I've experienced folk acupuncture from a chiropractor who obviously didn't have the necessary training." And I think this summarizes exactly what I'm saying. Notice the comment had no concern. There was no pain, there was no adverse effect. Rather, it was a patient saying, I had a better outcome with an acupuncturist than I did with my chiropractor. Well, amen. This board making the decision that a physical therapist can do dry needling does not limit that patient from continuing to make the same decision they've made. That's well within their right. I think also along with this marketplace argument, I guess, I think we need to look a little bit about what's going on across the country and also in Iowa with similar issues. In 18 states currently, this same argument is happening, whether it's acupuncturists going to licensing boards or legislatures to make changes in definitions to try to limit the scope of practice of physical therapists. Every time this argument is brought up under the guise of a safety concern, as we've already discussed, there is no safety concern. And so we have one of two things happening. Either the acupuncturists making this argument are uninformed of the safety, or they are waging a turf battle. And I don't think they're ignorant. They've spent too much time, too much money in fighting this across the country. So rather what they're doing is they're just trying to limit the choice of patients in Iowa and across the country. So what's going on across the country, 18 states? What's going on in Iowa? I'm not sure all of you are aware, so I'd like to bring that up so we know where we're at. Last year in the legislature, the Acupuncture Society tried to bring forth language that would drastically change the definition of acupuncture. I might say it's because of the argument I made earlier that Oriental medicine, if you change the definition, now you can include other people. You can tighten the noose maybe as to who can do what. Also, so that was the first thing that happened. That bill failed miserably. It didn't get out of the subcommittee, did not make the first funnel. They had a tough time. After that didn't get through, we all of a sudden now saw the declaratory order here, which you guys know more about than I do. So we've dealt with that issue. In the last week, there was a public comment, or there was a notice of order that there was going to be the Board of Medicine. The Acupuncture Society, through the Board of Medicine, was looking to make changes to the definition of acupuncture and a bunch of other terms. As of yesterday, the governor's office decided that those were inappropriate to be dealt with from the Licensure Board Act, from the medical board, because the medical board was trying to change definitions that are already in statute, and you can't, obviously you guys know the board can't do that, right? So this is an ongoing thing. When they can't get it done in one way and they don't get the answer they like, they move to the next step, and that's kind of what we're fighting with right now. I want to close with this. The board in previous years has kind of looked at definitions and decided that dry needling is not acupuncture and is within the scope of practice. And I think if we continue to look at the definitions, I think we'll find that that is still the appropriate, nothing's changed. And so I still think that it's appropriate that we determine that physical therapists can safely use dry needling. Thanks.